So I'm Billy Jo Blanton, and I'm the Mental Wellness Care Manager at Promise Healthcare. I offer case management services to those that are receiving mental health services at Promise Healthcare, and I also handle all of the internal and external referrals for those that are seeking mental health services. So case management is a collaborative process between a patient, a care manager, and their provider, even perhaps their family. And that is to ensure coordination of care and to make sure that they're getting a good quality service from Promise Healthcare. Well, those that receive case management from us are typically those with chronic mental health issues, maybe some mental health diagnoses, or even those that are struggling with substance use disorders. So what we do as a case manager is we try to identify where the patient's needs are and collaborate that with their provider to ensure that they are getting good quality care at Promise Healthcare, because we want to make sure that everyone is on the same page when it comes to what those patient needs are so that we can improve their health outcomes. By identifying a patient's needs, we are able to kind of fill those gaps and make sure that they are getting community resources that will, perhaps if they didn't have them, they may not get good quality health care or improve those health outcomes. So that can be things like transportation, their housing insecurities, food insecurities, anything that could ultimately affect their health or their getting treatment, then we want to address those to eliminate any of those barriers. There can be multiple challenges when it comes to case management. We have to collaborate with their providers, and sometimes that's multiple providers. Oftentimes, patients aren't compliant with their treatment recommendations or their care plan, so that can hinder some of the progress that comes along with improving their health. And so we want to really hone in on the patient and identify where those needs are so that we can address them in a timely manner and prevent any gaps that they're receiving and getting the health care that they need. Social determinants of health or drivers of health can be things like lack of housing, lack of food, lack of transportation to get to appointments. It can be financial matters. Anything that could ultimately affect your quality of life can ultimately also affect your health outcomes. And so we want to identify those and make sure that they're addressed, again, in a timely manner so that we can see those improvements quickly and just make sure they're getting that good quality care in collaboration amongst their family, providers, and the care management. We recognize the need in the community, so we do have a new school-based clinic in Rantoul at JW Ader. It's on the left-hand side of the building. And we also have a school-based clinic in Urbana. We're working to open another one in Champaign. Then we have our Neal Street location, which is off Neal and Charles. And then we also have what is historically known as our Francis Nelson Clinic, which is on Bloomington Road in Champaign. So people can learn more about Promise Healthcare by going to our revamped website, which is at promisehealth.org, and they can also call us at 217-356-1558.